Hey, She Slayers, this is a special sample cut from this week's episode. If you find this interesting, be sure to make time to go listen to the entire episode released this past Sunday. And please be sure to help a girl out and follow or subscribe to this podcast. So, as you guys started to work together and or honestly, just even if you're going to a networking event in town, and you're more brick and mortar stuff, have you guys experienced weird angst or hate about being a Chiro and PT together?
No, I think people think it's the coolest thing ever.
Okay,
Like, I think,
so outside of the professions, yes.
oh,
Inside
you
the
mean,
profession, so if you are talking then to more specific Chiro, are Chiros
um,
weird or PTs? Because I mean, Odell, I feel like I have seen some of your posts being in defense of, yeah, chiropractic is amazing. Almost
heck
having to
yeah.
stand up for that.
Yeah, yeah. So that was like more in school too, because I didn't know, I've always been like that even before I met her. I was like, I love the chiropractic profession. Like they're crushing it in business. So in school, when they say they shouldn't crack this or crack that, I'm like, you guys have no idea. Like, what are you talking about? I didn't
You
experience
were actually
chiropractic until the
you actually
NFL.
talked about that in PT school.
People in class, like
Okay.
small talk and debates and stuff, and I will always be on the side of, but I'm just like that mentally though. Like even
Yeah.
when they say personal trainers shouldn't use the term DPT because it's dynamic personal trainer, I'm like, I couldn't care less if they call themselves physical therapists. I don't care if you open a physical therapy clinic next to me, I will beat you. So like I had that mindset, so that kind of tells you. But everybody had that competition mindset, like, oh, people are choosing between chiropractic or physical therapist. I said, hey, they're doing a really good job at marketing their services. So instead, what I want to do is learn how chiropractors are everywhere and they market their services. When someone says my back hurts, you don't think of a physical therapist, you think of a chiro. So at the end of the day, we have to market ourselves better. So I was on that side of it, and then funny enough, I graduated and met her. But online, I just know like putting in the bio physical therapy versus chiropractic will give us more views, get more followers and people on my page. So, but I do have sometimes once in a while, especially like the pediatric chiro, I get like people commenting like, "Oh my gosh, I can't believe they would do adjustments on babies or something." And I don't really understand it, but I just love it. I'm like, please keep commenting. How could you do that? I
Get that
understand
engagement
collaboration,
up.
but like you should never collaborate with
So
someone's going to do that to a baby. But
you're fine with, so because I have a post right now that I'm so usually about once or twice a year, it's really nice for a write-off too, to help justify writing off travel. I will end up posting a video of me adjusting in a unique spot. Okay, so I've posted me adjusting Charlie in Mexico, and I just posted a video in November of me adjusting Kirby at Tokyo Disney.
so smart.
Now, it wasn't just that. I made a little jab at real doctor, whatever. And that bitch is still getting it. I mean, it was
Yes.
literally mid-November. It's got over 2 million views and just the hate comments on there. And I have ended up taking down every single previous reel because it just gets too much. And I'm just like,
Anytime she goes
I
viral,
can't
once the haters come, she's like,
go
I can't do it.
Oh
into
Oh,
man.
we got you. No, you.
I was like, I'm not taking it down this time,
Yeah.
but I'm just over here deleting comments because they're so mean.
Mm.
Bring it on.
It's like it's real people on the other side of that content. But at the same time, just have this is the perfect date night because it's have people around you that that same thing when you feel it. And we feel it at times. I'm like, oh my gosh. But we are each other's biggest cheerleader. And we're just there's always going to be haters. It means you're making an impact. It means you're being seen. And it's actually leverage it. We're bring it on. And then you start to change your mindset that before it would scare me. I'd be constrictive when I saw it. And now I'm like, oh, babe, someone put a hate comment or someone, and then they'll go back and forth. There's 32 comments and we're both cha-ching, get more people to our page, get more people to chiropractic and physical therapy, help more business owners, and ultimately share Jesus in the light. That's our job. So if we're focused on that, haters gonna hate. You know what I mean?
Literally. And most times all the hater pages, they're like blank avatars anyway with no face on it. So I'm like, if this person saw me in person, they would be the same person wanted to take a photo at the
I'll beat
conference.
you up.
They're literally
Right.
they'll literally be they wouldn't say anything.
Yeah.
So I'm like, okay, cool.
And that always changed it for me. You always said my job's to what's the one mini eyes, your favorite
Oh, you talking about the Bible?
Bible? Yeah.
Oh, Hebrews 12, 1 and 2.
Yeah.
Therefore, since I'm surrounded by a great cloud of witnesses, let us throw off everything that hinders. Let us fix our eyes on Jesus Christ, our author and protector of our faith. So, like, because we have so many followers and stuff, and people, all four of us, like, people are watching us, we're called so much higher to be able to live as an example and to show people what we're doing. So, I always told her when I first met her, she wasn't like doing huge online. I was like, you're doing the world a disservice that you're not showing what you're doing online because you're afraid of hate. There's so many
Was that
females
why?
out there with kids that want to like do what you're doing and realize that that's possible. So you're actually doing a disservice for 10 people out of the one person that's going to be mad at you because you're not showing people what's possible.
I had to hear him pouring that love and light into me for like a solid 4 to 6 months. And he'd be like, say your numbers, say what you made on your Airbnb, say what you, and I'm like, no, like minimizing it. And now I'm like, holy Moses, a $3,000 like rental just came in, and like all these people are inspired by it. And it's like, if you're rooted in that, like having it unlock for other people, because the truth is like, if the four of us can do it, and when we unlock YouTube and Spotify and like we're able to do these things, so can all of these people too, you know?
Right. Do you see a future where you guys kind of combine brick and mortars?
Yeah.
That's a good question.
We like, I don't know, you're gonna have to log into YouTube to find it. No, I'm just kidding.
Like, Abby, do you picture like doing one-on-ones and trainings for his like front desk and his doctor and things like that?
We already have that.
Well, that's kind of what I assumed.
It's so cool.
So it's like, okay, so Odell is coming in and getting footage and doing all this. He's very integrated into your clinic. And you're kind of integrated into his, like.
Yeah, so kind of how we have it split too. So I run the creative team, like all the VAs that do all of our editing, all that type of stuff. And then like the back end of grassroots as well, as far as like automation sequences, emails, automation tags, all that type of stuff, like mini chat type of stuff, and AI. And then she handles like front end, like we have a meeting every Wednesday now with like Team Globe, like we just did a HIPAA training and like different things like that, I have zero interest in.
This will blow your guys' mind too. We're doing Wednesday team trainings with, guess what? Physical therapists and chiropractors. And we're teaching them together business and communication and patient and sales and
it's the same
front desk, and it's all the same. And we're also really open mind to say like, oh, what do you do when you do this? Okay, cool. This is what we do. And this is why. And that was my meeting yesterday, is like, be the light. Like the whole Oakland, like the biggest hospital here, reached out. Their pediatric therapy. It's all OTs, PTs, and speech therapists. And they're like, can you come? We see that you're collaborating with a PT. Like it was kind of hush hush. Like, would you guys do that with us? I'm like, yeah. And then I got a text and they're just like, this is so cool. We can't wait to learn how we can like integrate chiropractic and physical therapy together and work on our patients together and all this stuff. And I'm like, this is so dope. So I can't wait to bring more awareness and like to capture our Wednesday trainings too, which we're going to do like cross professionally and with our teams. And
that's
stuff.
why the content's so powerful too. Even like locally, so many healthcare professionals, not just physical therapy and chiropractic as well, but have a ton of chiro followers even before being involved in the chiro world. But it's just cool because now they get to see what we're doing and we just show what we're doing.
Have you guys seen, like, are you guys building the example that you want to be, or have you seen any other place that's done this? Because like we have friendship with PTs in our town, but there's still that like, if I send someone over there, I don't know if they're coming back.
Oh, that is a big thing too.
Gosh, we can be the change for that, because the other thing, like when we work with our NFL guys, or for me, I'll speak for myself. It was my first time working with him on a patient. It was so cool to be able to have him there assessing and doing his portion, and me be able to clear different things out, and to like, just like be very vulnerable about like, oh, let me see if like how this clears out after you get done versus before. And let me have you do that release. And then I'll do a talus or foot adjustment. And it's so cool to see like immediate evidence. It's like proof of concept. You're like, oh my gosh, this works better together. And I'm sure in a few years, we're gonna be like, duh, like the same way, like, oh yeah, when I work out and eat right, it actually is like super helpful. You're like, oh yeah, cool. That's awesome.
Yeah. And so we refer a lot of patients back and forth. They have a higher volume. We're low volume, high ticket, and they're high volume. So all of our docs know as well. Like, so actually all of her docs came over to us to get care from my doc so they can like see what we do and know exactly what product they're sending people to. Then vice versa, having him come over and get adjusted for the first time. And he's like, oh, that feels good. And then he has a newborn. So it's like, oh, get your newborn in there. So now he's trusting it. And I even told him when I onboarded him, I said, hey, we get referrals from the thing is like, it's a mindset too, but it's cool. We get to show it. But like when someone sends me a patient and they're like, should I stop going to see my chiro or my massage therapist, my personal trainer? I'm like, no, I don't care who gets the credit. So I think as long as you don't care who gets the credit, I think it'd be fluid. But that owner that cares about them getting the credit, they're like, man, I feel so much better after coming to see you for 3 sessions. I'm like, I don't care who did it in conjunction with the chiro. And I always give them props. Like us working together is going to get you the best results.
And it's not that your massage therapist or your physical therapist wasn't doing anything. It was just more of a piece that was missing. And that's one of our culture values is like impeccable with our word. So we're on our team whenever there isn't on across the board for any professional or anything. We never speak to someone else's yard or what they do or don't do. We only speak to what we do.
Exactly.
It's super important.